So a blepharoplasty, somewhat of a complex word, and many people don't know what the word means. So a blepharoplasty is eyelid surgery, where people have droopy eyelids or bags under their eyes. Eyelid surgery is blepharoplasty. Blepharo is referring to your eyelids, and plasty means to mold. So when we break it down, we say, okay, there's upper blepharoplasty and lower blepharoplasty. Upper blepharoplasties are a little bit more straightforward, where we're taking a little bit of skin, a little bit of muscle, maybe a little bit of fat. This incision lies in this natural crease that is about a centimeter above your eyelashes. Lower blepharoplasty, a little bit more involved. So we're dealing with skin and typical fat herniation that's below the eyelid that gives you that puffy bags under your eyes. So with a lower eyelid, we can address them in many different ways, to where you can elevate a skin flap and a muscle flap and go in and get the fat from an anterior approach. Some people develop a skin muscle flap and then get the fat from an anterior approach. But another variation is what we call a transconjunctival approach, in which we go on the inside of the eyelid, close to the globe, make an incision to retrieve the fat, and then on the outside, again, that can vary. We can do a skin flap, skin muscle flap, sometimes a pinch blepharoplasty, which means we're just pinching the skin that is causing this excess. When we're doing a lower blepharoplasty, we're typically addressing multiple things, and that is we'll call it fat herniation, though the definition herniation, if it's whether actual herniation is debatable, and you're addressing the loose skin. So much more complex compared to the upper eyelid. When someone's referring to a blepharoplasty, there's probably going to be three options, and it's going to be you either get your uppers done, you get your lowers done, or you get both upper and lower done. And we call it a quad blepharoplasty. Quad, obviously, being 4. Reason being is typically when you're aging, you are aging from head to toe. So if your upper eyelids are showing your age, your lower eyelids will likely need something addressed to.